Hi, I'm Dr. Faber, and I work at the Children's Institute in Livingston and also practice in Upper Montclair. And I'm going to be discussing anxiety in autism spectrum. And anxiety comes in different forms, and one type that we often see are those under the umbrella of OCD type behavior or obsessive compulsive type behavior. And for those on the spectrum, we might be talking about inflexibility, rigidity, preference for routine, perseveration, or fixating on certain topics of high interest. And we know that if a person has a strong interest in an activity and is reluctant to transition from that activity, they might become highly anxious and even irritable. Traditionally, OCD is looked at as checking, counting, hoarding, hand washing, repetitive statements. But for kids on the spectrum, as I said, we often see this OCD type range of behavior. Now, in terms of how to address it, behavior-based strategies are often a first-line approach. And this may utilize the approach called exposure with response prevention, namely allowing the person to speak about or engage in the repetitive behavior for a limited period of time and then be on task for another period of time and then be permitted to resume that activity. But the amount of time spent is restricted and limited, and the person is reinforced for being able to, quote unquote, let go of that thought or of that behavior. In terms of medical strategies, the class of medication we often consider are the SSRIs, or serotonin selective reuptake inhibitors. And we'll talk about that separately when I go over medication. Another type of anxiety that we might see with kids on the spectrum is a tendency to worry or dwell to excess, and we refer to this as generalized anxiety. This may be associated with headache or stomach upset and various other bodily complaints. Other kinds of anxiety might be some discomfort interacting in social or performance situations, and even discrete anxiety attacks. What's most important is to recognize that for many kids and teens on the spectrum, anxiety may manifest with periods of irritability or even tearfulness. It may not be verbalized necessarily as, quote unquote, I am feeling anxious. So it's important to evaluate and address this. Thank you.